We'll take a short break, and when we return, new COVID-19 cases are popping up in places where the virus seemed under control. What does it mean for the battle ahead and for our new normal? Stay with us. The total number of reported COVID-19 cases is nearing the 8.5 million mark, with global deaths reaching over 450,000, and fresh clusters of cases, even in countries where the virus seemed under control, are proving just how complex the fight can be. Beijing reported 25 new locally transmitted cases on Thursday, bringing the total since June 11th to 183. But Beijing is not alone. Singapore and South Korea have both seen a resurgence this past month. And New Zealand, after declaring the entire country virus-free just a week ago, reported 2 new cases from the UK. What do these new clusters tell us about the road ahead? And as countries start to reopen their economies and loosen restrictions, what lessons from the past can we apply now? Joining me for the discussion, Dr. Eric Dean, epidemiologist at Harvard University and senior fellow at the Federation of American Scientists, currently in Washington, D.C., and Dr. Zhiwei, director of the Center for Public Health Research at the Medical School of Nanjing University via Skype in Nanjing. Dr. Dean, let me start with you. Given Beijing has been taking such thorough and rather tech-savvy measures in preventing the spread of the virus, the new cases took many by surprise. Are you surprised?
In many ways, I'm not surprised, given what we know about this virus. It is just really darn infectious. And moreover, it has a tendency to super spread whenever it can. And a marketplace is one of those perfect situations. And it was only a matter of time that something like this cropped up and flared up into an outbreak again, because we know so many people, anywhere from 20% to 50% of all cases are asymptomatic. And when you have asymptomatic cases, it will always keep floating around the population to some degree at a low level and then flare up, such as what we are seeing now.
Dr. Wu, I guess it's fair to say that a lot of people weren't surprised either, because epidemiologists have long warned that the fight against the pandemic is not over, that the virus is going to be here for quite a while. But this is an important issue for people battling this coronavirus. They think back on what they could have done, and they think about what they could have done better, what they could have done more. Do you think that this shows us just the complexity of the virus and the need to adjust people's expectations about returning to the normal?
Well, actually, it's a complex issue because we still do not know a lot of things about the virus. Apparently, from the Beijing cases and also from cases in northern part of China, you can see that although you don't seem to have active cases for an extended period, but actually they come back pretty quickly and forming various different small clusters of infections. And this time in Beijing, actually, was surprisingly appeared, in the also in the seafood market as well. So it's a very complex issue. We don't know where this new source of infection came from. So this actually says again, we have been talking about for a long time that this virus actually may come back, form a small cluster of second wave. So this is something we need to be really keeping vigilant and keep a close eye on it.
Dr. Ding, as Dr. Wu just pointed out, we don't yet know how those new cases in Beijing happened. But just a quick question, does the fact that these cases are traced back to a local market here in Beijing hold any particular interest to you? Because thinking back on Wuhan, the first COVID-19 cases there were also believed to have originated in a local seafood market in Wuhan. The similarities here between the seafood markets, do they hold particular interest?
I don't think it's necessarily the seafood market. I think it's just that in the marketplace, it's where a lot of people come together, mingle, and sometimes animals could be a reservoir for it. And just so you know, the Wuhan seafood market theory has been pretty much debunked by many people. The latest studies show that, for example, in France they identified it in December, and the latest study in Italy and in Milan and Torino found it in the wastewater in December 18th. So I don't think the seafood market origin is the actual origin, but I think a marketplace is a perfect nexus for interchange and exchange of an epidemic for it to super spread. So I only find it interesting because it's where there is a lot of people coming together.
Got it. Dr. Ding, what do you make of Beijing's reaction this time? Because what struck me is how swiftly the government acted in terms of testing 356,000 tests in just 5 days. That's what, over 70,000 tests per day in just one city.
Yeah, I think that is a very aggressive testing, and more countries should kind of emulate that kind of level of testing on a per capita basis, especially in such a small district region of Beijing. At the same time, testing, we know that there is imperfection in the testing, that you cannot pick up cases earlier than 3 days, and beyond a certain level, the sensitivity of tests do drop off. So we can test all we want, but at the same time, we have to be realistic that we'll likely be missing anywhere from 10 to 15% of people just by testing a one-time test. So this is a very difficult virus, and high-volume testing is good, contact tracing is excellent, but we have to realize the virus will always find a way to evade us if we're not vigilant.
Dr. Wu, we heard from the chief epidemiologist with China's CDC, Wu Zhunyao, who said that the outbreak in Beijing has been brought under control. Now, he had to know the weight a statement like that carried and the potential consequences of making a statement like that, and yet he still felt confident to make it. What is your read on the situation in Beijing?
Well, actually, I think we have to be very cautious about this. Although right now that we do have a pretty good control and the containment of this second cluster of infections in Beijing, but it doesn't mean that the virus actually is not going to come back again. The thing is that we have been talking all along that the asymptomatic people actually could transmit the virus and then infect other people. I think this is basically one of the problems is that we have all the tools. So we know that how the virus actually transmits into others. But the problem is that we don't know where the virus is. So basically we are fighting against an invisible enemy. So this actually put a lot of constraint and pressure in the public health and disease prevention measures. So although right now, I mean, we do have, because of a very rapid response and well-structured containment measures, we do have a pretty good control of the virus spreading, but we have to be very, very cautious and keep vigilant and keep a very active approach.
I see. Dr. Ding, we're essentially doing two things right now. On the one hand, we're battling this new outbreak in Beijing. On the other, we're taking the opportunity to reflect on what this tells us about this new reality we should get ourselves ready for. When you think about it, do you think this is a one-time sort of thing, this is just one resurgence, or is this a new reality going forward from now that we could see resurgences like this pop up, every couple of months? Because what we're seeing is that in other places in Asia, in South Korea, in Singapore, these were considered early success stories in terms of controlling the epidemic. They're all seeing new clusters pop up. What do those tell us about the reality we find ourselves in?
Yeah, the reality is that this is one of the most difficult pandemic nightmares we've ever faced. As Dr. Anthony Fauci of the U.S. National Institute of Allergy and Infectious Disease, says this is his worst nightmare because this virus is so contagious, it has a tendency to super spread whenever given the chance, and it has such high number of asymptomatics and pre-symptomatic people who are potentially transmitting this virus. And so that just creates this perfect storm in which we will continually have these up and down mini waves, hopefully small flare-ups, but hopefully not a full resurgence and a full large outbreak epidemic. But this is what we will live with until we have a vaccine that we can give out to everyone in the world.
Dr. Wu, until we have a vaccine readily available, accessible, and affordable for everyone in the world, we probably will have to live with this reality in the foreseeable future. Help us understand and envision this new normal of living with coronavirus. What should we watch out for? How should we adjust our expectations? And how should we get ourselves ready for a protracted war against COVID-19?
Well, actually, it's a very difficult situation right now. As Dr. Ding mentions, that actually this virus actually has a tremendous ability to evade our surveillance and then transmit it to new hosts. So actually, we do have certain experience in dealing with it and how to prevent it, but actually the cost is very high. Basically, by simply locking down the city and doing, extended period for social distancing and closing down the business, apparently is not a lasting, not a sustainable measure. So we do have to take precautions, but like a general practice of social distancing and wearing face mask and washing hands. Those are the very basic measures we really have to take to deal with the virus. But in the long term, I think we do have to rely on vaccines and other therapeutic as well, basically to cut down the viral transmission.
All right, Dr. Ding, Dr. Wu, thank you so much for helping us understand this new reality. We certainly appreciate your expertise and your insight. My thank you to both of my guests there. And we thank you for staying with us on this edition of The Point on Zhongshi in Beijing.